Bismillah ar-Rahman ar-Rahim. Ma'am, thank you very much. First of all, I would like to extend my gratitude to the Dawn Media Group for convening such an important session and event, and in particular for giving representation to Azad Jammu and Kashmir. So, the crux and discussion of the today's event, taking that forward, I would like to just highlight that the Azad Jammu and Kashmir, that is, we call it the state of Azad Jammu and Kashmir, that comprises 13,297 square kilometer, with population having around 4.563 million as per the latest census report. And the areas which I would like to highlight, that certainly we have some success stories, and at the same time we too have some challenges. If I discuss the success stories, the first, that recently, a week ago, we have been, the government of Azad Jammu and Kashmir have been able to merge the population and health department under one minister and under one secretary. And this is the process which is going to improve the service delivery in Azad Jammu and Kashmir. And when I quote this success story, I must acknowledge and give the recognition to the UNFPA, because it was their efforts, those started in 2020, and finally the effort succeeded, and now just a week before that has been notified. Another important issue is, if we look at the policy side, that after overall, we can say that the general awareness, the government of Azad Jammu and Kashmir has been able to draft draft of the law that is titled the Child Marriages Restraint Act. So that is almost, we are having the consensus on it, but that is at present pending before the Legislative Assembly. And before coming to this session, I checked from the Assembly, and what they informed that hopefully that is likely to be tabled and passaged in next session. So in that way, hopefully this would be another achievement. And third important thing that I would like to discuss over here is that, as our learned participant earlier said, rather learned speaker said, that unless we may give the central position to the women, and that can only be achieved through the better education, certainly the target set under the CCI recommendation and for the population development, that cannot be achieved. So in this perspective, I would like to add that in Azad Jammu and Kashmir, in every district, there is a university. And now, there are one or two districts, those are left over. The government has already announced, and we are looking forward that in a couple of months, that bill shall be passed, and those districts shall also be having the universities. And we have one particular university for women, that is the Women University, Bog, and likewise we have the 4 medical colleges. So I mean that these are the things which are adding support to the cause of family planning and reproductive health, because with the better education only we can succeed to get the targets. And this is the way that at this point in time, Azad Jammu and Kashmir is having the literacy rate 77.5, which is quite on higher side if we compare it with the national figure. Likewise, if we see towards the women literacy rate, that is 68.2. Okay. Now, finally, I simply discuss the challenge. That in a 1 minute I am going to conclude it, that the challenge the Azad Kashmir government, and as my learner friend from the GB said, that is you can say the 18th amendment. With the 18th amendment, though the provinces, they are getting the more share, but the Azad Kashmir and the GB, they are not getting any, they not being the part of the NFC world, they are not getting any share. So I would request that Ministry of National Health Services and PPW, they should continue to support the regional governments, I mean the regional departments, that is the Population Welfare Department of AJK and GB. In this way, I hope that we can continue and we can have the more successes. Thank you very much.